most nerves are relatively evenly mixed, like 50-50. They're not 50-50, but relatively evenly mixed between afferent and efferent. The vagus nerve is about 80% afferent. So about 80% of the traffic of the vagus nerve is going from the organs to the brain. It's telling the brain what's going on with our internal structures that are subconsciously regulated. And then the brain, if it's receiving the proper information, can respond appropriately. What happens when the sympathetics go up is the vagus nerve gets heavily inhibited. The brain stops receiving proper signals from the organs. And if it's not receiving the proper initial information, it has no chance to regulate the organs properly. So by stimulating the vagus nerve, that's our highest leverage way to stimulate the parasympathetics, which reciprocally inhibits the sympathetics and pushes the autonomic nervous system towards homeostasis. This is not something that I learned in school. I ask every class, every weekend I teach you guys. Basically 0 people know this before I tell them this. So the only area in the body that we can directly treat with needles safely that's innervated by the vagus nerve is the ear, right? So I have an article on this on our website. There's a bunch of articles on there. You guys can take a look. I've got pictures. I'll add some pictures in here for you guys. It's the concha and the symbiconcha of the ear, right? So it's like the inner bowl of the ear. That is the auricular branch of the vagus nerve. So as far as I understand, that is the highest leverage place that we can to stimulate parasympathetics and depress sympathetics. So the ear, number one. And then after that, I would love to have some more machinery to know like the power of each of these other places, but they all work, right? So I do all of them as many times as I can with my patients. And these are the first needles that I put in my patients, you guys, and I'll explain that in a little bit. The other areas, if you look in neurophysiology books, we were all taught this in grad school, the parasympathetic dominant portions of the sympathetic chain, right? So we have a chain that goes from our brainstem all the way down to our coccyx. The sympathetic portions are from more or less C7 down to like L1, L2. And then you can think about the parasympathetic portions as above C7 in the sacral plexus S2 to S4. If you want to get a little bit more specific up in this area, think about C2 up, including the head and the face. That's very, very parasympathetic dominant, right? It's in part due to the proximity of the vagus nerve itself that comes out of a little foramen underneath the mastoid here, right, along with the glossopharyngeal nerve, which is one of the other parasympathetic dominant cranial nerves. The 4 out of the 10 cranial nerves that books typically talk about as being the most heavily parasympathetic are the trigeminal, number 5, the facial, number 7, the glossopharyngeal, number 9, and the vagus, number 10, right? So the vagus and the glossopharyngeal come out of the same little hole in our skull right underneath the mastoid. C2 is another really good place to needle itself. So C2, the base of the skull, the suture lines in the skull, you guys, are super, super important. There was a brand new study that just came out a few months ago showing that we actually have active stem cells in the suture lines of our skulls in adults through life, when previous to that we just thought that they were in the marrow of our long bones, but we know now that they're in the suture lines. And acupuncturists have done some really, really cool studies using the Western medical acupuncture, where they still use the acupuncture points, but they don't talk about the meridians. They talk about what needling those points does to the autonomic nervous system using brain MRIs and fMRI and stuff like that. Cranial suture line needling is extremely parasympathetic. Really, again, if you just want to keep it simple, think about C2 and up, and then the pelvic floor and the sacral plexus. So the sacral plexus is S2 to S4. All 9 of the true pelvic floor muscles are innervated by some combination of S2 to S4, aside from the obturator internus, which has some lumbar innervation, but that's about it, right? So all 9 pelvic floor muscles, just think about S2 to S4. Obturator internus is the only one that has innervation from outside S2 to S4 in the lumbar spine. But the pelvic floor and the sacral area are also extremely parasympathetic dominant. So by needling those areas, especially if you use low frequency electrical stimulation, 1 to 5 hertz, I like using 1 hertz. It's the closest to regular heartbeat. I've never seen a study on that, but that makes sense to me. It seems to work the best with my patients. If you needle those areas and you connect them to each other, you get a massive amount of parasympathetic stimulation, which reciprocally inhibits the sympathetics. And you can see this in reality, you guys. When you do this, your patients will get super duper tired after a treatment. Now they do that, most people do that after any needling, because again, no matter how you needle, the overall result is parasympathetic dominance. However, we can leverage that fact and make that outcome much, much more significant if you're specifically focusing on treating the autonomic nervous system rather than the underlying condition itself. So if you're treating the autonomic nervous system, you guys, you're always going to be led to treating the area of primary complaint because that just makes sense, right? Like if somebody comes in with a knee problem, you're going to treat the knee. But what most people do is they just treat the knee or like just that leg and they forget about treating everything else because they're not thinking about the human body in the proper way. The way the body works, if you have autonomic homeostasis, if you have autonomic homeostasis, the typical condition of the human body is health, right? When you go into unhealthy land, the autonomic nervous system becomes more dysregulated into more chronic sympathetic hyperactivity. Just to recap what we've talked about so far. So think about dry needling using this two ways. We want to specifically regulate the autonomic nervous system from the chronic sympathetic hyperactivity back towards a relative neutral. The two easiest ways to do that are treating as much soft tissue pathology as we can, which increases mitochondrial oxygen saturation. It increases the amount of energy, ATPs, those mitochondria are producing by 18x. And we want to target the parasympathetics themselves, which also inhibits sympathetics. So now we're approaching depressing the sympathetics from two different ways. We talked about the locations to depress chronic sympathetic hyperactivity, which would be C2 and up, the sacral plexus stuff, and the stuff it innervates, right? So basically anything from C2 upwards, especially the suture lines in the skull, anything that S2 to S4 innervates, which would be right over the sacrum, and then down into the pelvic floor. And then the highest leverage parasympathetic treatment that we can do is the ears, you guys, the auricular branch of the vagus nerve in the ears. This is a very, very easy sell to regular doctors. And this, I think, is surprising to a lot of people. You would think that regular doctors would be like, why the hell would you needle the ear? Right? However, vagus nerve stimulation in the ear is currently FDA approved for anxiety, depression, some strokes, epilepsy, and it's being studied for a huge amount of other stuff. And it works great for everything. Why does it do that? Because there's no pathology that doesn't get better with a more homeostatic autonomic nervous system. And by needling the vagus nerve, we're making the autonomic nervous system more homeostatic. Another aspect of stimulating the parasympathetics, you guys, and they've done some studies on this, there's not a ton of them, but I can just tell you from 10 years of clinical experience doing this and teaching this stuff to thousands of other doctors, that the outcomes that you get with your patient significantly improve when you start utilizing needling in this way. On average, and this is a huge average, it's not a great number, the study wasn't very big, just like all studies with dry needling. However, it's what we have to work with, and again, I can just tell you from my clinical experience. On average, it takes about 15 minutes after the needles are placed in the body for the parasympathetic autonomic nervous system to become dominant. During those first 15 minutes, the sympathetics actually spike, and this should make sense, right? Like we're getting stabbed with sharp stuff. The body goes into sympathetic hyperactivity when we're getting poked with sharp things. What we want to do is limit that initial sympathetic spike as much as we can. So that sympathetic spike is what causes people to go into a vasovagal response, you guys. So it's not just a parasympathetic thing, the vasovagal response. It's actually an overreaction response to the sympathetics going up too fast, too high for that individual's threshold, right? So if you're poking needles and the patient's sympathetics start to go up too fast, too high, the baroreceptors in the carotid arteries are going to sense the increased blood pressure. And then at a certain point, the parasympathetics overreact and they say, no way. And they turn all the way on, which turns the sympathetics all the way down for a second. Your blood pressure drops. And in the most severe cases, you pass out. Now, passing out from a vasovagal response is not a dangerous thing. It's a protective mechanism of the body. However, you obviously don't want to do that. And I've never had a patient pass out on me, you guys. It's pretty obvious when they're going that direction. They'll start to sweat everywhere. They'll get like pasty white. They'll start to feel kind of loopy. It's a very uncomfortable experience. I don't think it's a bad thing. It's just very uncomfortable. So if we go back to thinking about, okay, if we need to treat as much tissue pathology in the body every time we treat people, plus targeting the parasympathetics, one of the things that allows us to put more needles into more of the body is targeting the parasympathetics with your very first needles, right? So if you're initially stimulating the parasympathetics, remember the autonomic nervous system is like a seesaw. If you're initially stimulating the parasympathetic side, that's going to inhibit and depress the sympathetic side. So that initial sympathetic spike that happens for the first 15 minutes or so, it's going to be dampened in amplitude and duration. This makes treatment much, much more comfortable for people. It makes it much less painful, and it just amplifies the nervous system shift that you get. So this happens no matter what, even if you just poke needles in and take them out, which is not nearly the best way to do it. I know a lot of people on their time constraints, and that's why you guys should check out our school channel, Private Practice Playbook. You just can't utilize the skills that you learn in school and after school properly in an insurance-based clinic, right? And don't even get me started on that stuff. I'll do another video on that. However, if you're working for yourself like I do, you have as much time as you need, more or less. So the ideal time to leave the needles in the human body, you guys, and again, I would love for somebody to do a study on this if anybody sees this. They've done studies looking at that initial sympathetic spike that takes an average of 15 minutes and then it depresses and then the parasympathetics come dominant. What I would like to know is, on average, what is the time of no returning improvement in outcome as far as the autonomic nervous system goes? I used to think it was like leaving the needles in for half an hour. However, the more and more I've done this over the year, you guys, I'm absolutely convinced that the ideal time to leave the needles in is somewhere between an hour and an hour and a half. If you leave the needles in as long as you need to get that nervous system to shift towards parasympathetic as much as it will, that is how you're going to get the maximal outcome each time you're treating somebody. So I try to leave the needles in my patients at least for an hour. And again, this obviously depends on your patient, right? I tell them, hey, I would like to leave these in for about an hour, maybe a little bit longer. If you're getting uncomfortable, if it hurts or whatever, we can take them out sooner. It's going to be helpful no matter what. It's just up to a certain time duration, you guys. The treatment gets exponentially more effective if you leave the needles in the body while the nervous system is shifting until it's done shifting, right? One of the best ways that I know how to tell this to you guys is if you stick the needle in and you rotate it, right, and you just keep barely trying to pull it out, if it's tight at all or if it's stuck, that means at least that specific tissue that needle is still sympathetically dominant. Muscle contraction is a sympathetic process. Muscle relaxation is a parasympathetic process in general, not fully one way or the other, but in general, right? So if the needles come out like they're just in a stick of warm butter or they fall out, you at least know that tissue that needle was in is now in parasympathetic dominance. So I think that's the best mechanical way that we have to tell in a clinical setting what is going on with the tissue that the needles are in specifically. And again, you guys, I think I was trained just like everybody else was trained initially. You do pistoning, which is not a good thing to do. It stimulates the sympathetics way too much. It inhibits the amount of parasympathetic dominance that you can. It aggravates patients more, and it's just not the best way to do. So if you stick needles in once and rotate them until they're tight, that expands treatment area out, up, and down, and it gives you the maximum treatment for each needle, which is going to allow the most mitochondria to get oxygen saturated. It's going to put as much energy back into the autonomic nervous system as we can, and you're going to restore homeostasis and energy balance as quickly as you can. Just to recap, I target the parasympathetics with the very first needles that I put into people. And it just obviously depends on their position. If they're in prone or supine, you can always get one ear or the other, even if they're in side lying. So I try to target as much of the parasympathetics as I can first. So that would be the ears, the upper cervical and cranial area, and the sacral plexus and pelvic area. And then I move on to treating whatever else I'm going to treat on the patient. So if somebody comes in with like a knee replacement, no matter what condition they come in with, I'm always targeting the ears and other parasympathetic areas first to limit that initial sympathetic spike. I like to connect the parasympathetic areas to each other, you guys, and I always like to cross the spine, right? Crossing the spine is very, very important because it's stimulating at low frequency right brain, left brain, right brain, left brain. This is the way that EMDR psychotherapy works. It's a very, very effective form of psychotherapy. It improves neuroplasticity. The same way that like psychedelic assisted psychotherapy improves neuroplasticity, that low frequency stimulation getting left brain, right brain, it does something to massively amplify the neuroplastic effect of treatment. It's the same way that the binaural beats do it, you guys. If you look at the binaural auditory beats, it's low frequency for the most relaxing stuff, and it goes left, right, left, right. As we age, the problem that human beings have is we have impeded or inhibited communication between the left brain and the right brain, which is one of the things that causes problems, right? So if you can stimulate alternating areas of the alternating sides at low frequency, remember I like 1 hertz, it's the best way that I've figured out so far to maximally amplify parasympathetic dominance, autonomic nervous system homeostasis, which is the key to health. Thanks for listening, you guys. This was our talk on treating the parasympathetics with needles. We'll do lots of other videos about this stuff. If you guys have any questions, check out our website, intricateartseminars.com. We have 2 online dry needling courses and a live online dry needling course, plus 5 in-person dry needling courses. We also have 3 manipulation courses and 5 online nutrition courses. Here's a free link to the Intro to Nutrition class. I think you guys will really like that. Check out our online dry needling classes. We have a 15 CEU online dry needling class for $299, all about how to treat the autonomic nervous system. The other one is 10 CEUs for $250. It's all about men's and women's pelvic health, which is also a great autonomic nervous system treatment. I think you guys will enjoy those.